Thank you very much for your 2 minutes of patience. We are going to begin. This public meeting has been called to discuss the very, very crucial issue of Black maternal health. Now, you would have heard the harrowing statistics that Black women are 4 times more likely to die in pregnancy and childbirth. And that is no small thing when we think about the numbers. And women of African heritage are 83% more likely to suffer a near miss, that is, to nearly have to die during their pregnancy or to lose their child during their pregnancy. And women of Caribbean heritage are 80% more likely to suffer a near miss. Now, a report released at the end of last year by the Joint Select Committee on Human Rights found that whilst the government and the NHS were well aware of these figures and well aware of these issues, they had no plans and no targets to bring it to an end. That's an absolute disgrace. And I know that women right across the country, Black and white, felt that was an absolute disgrace. And the fantastic campaign group, 5 times more, have been leading the charge in Black maternal health and attempting to get better outcomes for Black women. And they put together what is now become an award-winning petition, which had nearly 200,000 signatures. And on Monday, this is going to be debated in Parliament for the very first time. So ahead of that, we wanted to come together with so many different people, so many different groups, women who have had personal experience, women that are activists, and attempting to reduce these disparities, just to make sure that everybody has the facts, allow people to ask questions, and some people have already sent in questions, which is fantastic, and to see what we can all do to come together to make sure that the NHS, that the government are taking this issue seriously. The colour of a woman's skin should not impact her health or her child's health. It's something that I've experienced personally, and I know women that have, and there are so many others right across the country, especially because of the lack of data that is being collected amongst Black women to explain why these issues are occurring. And we're going to get into that discussion a bit later, but there's been a lot of blame placed on Black women themselves as to why they're having these outcomes, which I think, again, is another disgrace. And that against a backdrop of a report which says that institutional racism doesn't exist. Now, if there are any figures to prove that it does, and obviously that there are so many different ones right through society, that the absolutely staggering statistics of Black maternal health should definitely do that. Now, the first speakers I'm going to hand over to are Tanuke and Chloe, who are the founders of 5 Times More, and who I explained have been leading the charge. You may have seen the Dispatches documentary, I think it was last week or the week before, where they highlighted all of these issues and speaking to a range of different people. That's definitely helped to raise awareness, and all of the fantastic work they are doing has done that also. So Tanuke, would you like to begin?
Thank you so much, Belle, and thank you so much to everyone for joining us tonight. My name is Tanuke, and I'm here with my wonderful partner, Chloe. We are the founders of the 5 Times More campaign. I have a short, okay, it's not short, but I have a presentation to give you guys on this issue and tell you a little bit more about who we are, what we do, how we started, and what we want. So let me go ahead and share my screen, if you bear with me a second. Okay, I'm not the best with technology, so I hope you can see that. Okay, great. So 5 Times More, addressing Black maternal disparities in the UK.
So this is a quick trigger warning. You're going to hear some traumatic stories and traumatic quotes from mothers, and we'd just like to let you know if you hear anything that's a bit traumatic, please get in touch with us and we'll signpost you to the relevant services and organisation. Another thing is we want to say that it's still relatively safe to give birth in the UK, so we don't want to scare no one. It is safe to give birth in the UK, it's just that Black women have a worse experience.
So, what is 5 times more? We are a grassroots campaign committed to highlighting and changing Black women's maternal outcomes in the UK. Who are we? That's me, heavily pregnant about a year ago, with my daughter Eden, who is about to be 1. I'm the founder of Mums and Tea, and I have a son. I gave birth to him in 2017. I had, I would say it was a traumatic experience for myself. My preeclampsia was diagnosed late, even though I was showing signs from midway through my pregnancy, which led me to be induced. However, when I presented at the hospital, I was told, I can't leave the hospital without having the baby. I was told by the midwives that basically I wasn't believed that I was in labor, and it was a harrowing experience for me because I was literally vomiting. I was bent over double. It was really horrible to have the midwife tell me basically that she didn't believe I was in labor. She wasn't going to check me over, and I actually progressed very quickly. In the end, I ended up having a forceps delivery, which that in and of itself is not the end of the world. It's not traumatic in itself, but I did just left the hospital feeling like I just wasn't listened to. I felt like I didn't need to have gone through all of what I went through. I wasn't offered any pain relief, and I just felt like my pain wasn't taken seriously. I was dismissed quite a lot, even though I had preeclampsia, which is, quite a life-threatening condition. So, as I said, I run Mums and Tea, which is a social network for Black women and Black mothers to come together and just have fun whilst they're on maternity leave and beyond. And through speaking to other Black women, I realized that what I went through was not a situation that was an isolated one. There were indeed many other Black women who were experiencing, sort of poorer outcomes and poorer experiences and are having traumatic birthing experiences. And so I said to myself, well, that's something here is not quite right. And then in 2018, the year after I gave birth to my son, the statistics for the Embrace came out showing that Black women are indeed 5 times more likely to die. And I guess I was shocked, but I wasn't surprised when I heard those statistics because of everything that I was hearing, through talking to Black women in my community. And I thought it was just really sad that the one thing that was tying us all together in these poorer negative experiences was the fact that we were all Black. So I studied psychology as by way of background. I'm quite a nerd. I love my research. I love to go into, I just want to know. I wanted to know what was going on, right? And I saw that if you look back at the data and the reports, this was not new information. This is something that had been happening for literally decades. And I'll try and put it into context for you. And this is what you may have seen if you saw the Channel 4 documentary, but I'm showing my age here. 1991, my mum gave birth to me, and you can see through the data that as a Black woman, she was more likely to die, but there just wasn't any data collected on ethnicity, so they didn't know just how much. And over the years, you see that number going up. It's going higher and higher. 2018, Black women are 5 times more. I'd given birth to my son. I was 5 times more. Why we're campaigning and why this is so important to me is I have a daughter now, and I do not want her should she choose to give birth, to be 30 times more likely to die, 15, 20 times more likely to die. I do not want her to be campaigning about the same thing. So that is why I decided to join forces with Chloe, who is the founder of Disparities. She will tell you more about what she does and how this all fits in together. But we joined forces and we said, look, we've got to do something about it. We've got to scream and shout and make sure that people hear us. So we'll go into a bit more about, you know, kind of what we've achieved and what exactly what 5 times more has done. But I'll hand over to Chloe, who will tell you her experience of prosperities and how we got together to start 5 times more. You're on mute, Chloe.
Sorry, I was on mute. So I run an organisation called Prosperities, where I support Black and South Asian mums in the community, mainly in Lambeth and Southwark, but due to COVID, I've been able to support mums all over the UK, and it's mums that are pregnant till a year after giving birth, and it's all free support. I tell them about their birth options, their birth rights, and I help them advocate for themselves, and I advocate for them as well.
So right now I'm going to read a few quotes from Black mothers. So we know about the mortality, but we actually don't know about morbidity. And we hear a lot of stories and experiences for Black women across, you know, across the country who reach out to us via emails, via DMs, via social media. So I'll read the one at the bottom here. You know, as soon as the second midwife was on shift, she just seemed to have one goal in mind, and that was delivering my baby as soon as possible. She didn't seem to care about easing any part of my pain or reassuring me for the many worries I had at the time. She rushed my labor along, and as a result, almost cost me my son's life.
So what do we do? Our number one goal is to actually empower women. So what we have 6 recommended steps for Black mums, but all mums can use it. And once a month, we give out 100 free hypnobirthing courses to Black mums. We educate, so we have teamed up with RCOG, which stands for the Royal College of Obs and Gynae, and we have come up with 5 steps for health professionals to use, so Black mums can have a better outcome. We also give talks to university, so university students, which includes student midwives, student doctors, university medical societies. Amplify, so we like to amplify Black women's voices. We don't just like to talk about the negative experiences, but we also like to highlight the positive experiences. And we raise awareness. So if you can see on the side, we've got a 5 times more selfie, which is like this, which is like a stop sign. And we use that on social media to raise awareness of the disparities. And also lobby. So our petition, which gained over 187,000 signatures back in June, is going to be debated in Parliament on Monday at 6:30. We also have an MP writing letter campaign, which we ask everyone to write to their MPs about the disparities. Last year, we submitted written and oral evidence to the Maternity Safety Inquiry.
So here's just a list of things that we have achieved so far. I won't go into them, but a few notable ones are the fact that we are members of the RCOG Racial Equality Task Force, which was set up back in June, I think June of last year, yes, June of last year, in order to tackle these disparities that we see. And we are also recently become part of the NHS Race and Health Observatory Maternal Health Group as well. We've been featured in a number of publications, including CNN, British Vogue, The Guardian, HuffPost, ITV News. That's just part of the awareness raising piece. We believe that, you know, you can't change something that you don't know about. So we are very big on, number one, raising awareness, and number two, what are the tangible actions we can do? What are the things that we can you know, physically do to try and change this, the disparities and inequalities that we're seeing. So I don't want to repeat, but that's just a little overview of what we have been able to achieve so far. And I think Chloe might have mentioned it in one of the earlier slides, but we are the creators of the UK's first Black Maternal Health Week. Last year, in September, we held an awareness week. We had a different theme for every day, and we wanted to use it to amplify the voices of Black women, because they often felt like they weren't listened to. That is a common thing that we hear. So we wanted to use this week to amplify their voices. We held an online event with health professionals and mothers, and we also finished off with a list of things that that we wanted to see. I just wanted to highlight here that we started the Awareness Week on the 16th of September, which would have been Delissa Parks' 31st birthday. Now, Delissa Parks' mum is here and she will be giving a talk about what happened to Delissa Parks, but we wanted to use that opportunity to honour what would have been her 31st birthday. What happened to Delissa Parks was very, very, very unfortunate and very sad, and we wanted to make sure that within that week we remembered her and her legacy would continue on. So I'm going to go on to the next slide, and just a few things that we finished off the week and we said that we wanted to see. We wanted people to stop using the word BAME because, it's a catch-all word. It's very lazy. It's lumping anyone who isn't white into the same category. And I think it's really important, especially when you're talking about these statistics, to say Black if you mean Black, because Black women have indeed have had the highest risk and have done so for decades now, as we see. The data doesn't lie. So, instead of saying BAME, which captures everyone, say Black if you mean Black, and don't be afraid to say Black. We want people to listen. I think, we ask women to speak up in our campaign, but we want health professionals, and that is one of the steps that we have with the RCOG. The first step is to listen to our voices and our experiences so that you can learn from them and administer better care for Black women. What also do we want? To go beyond the statistics of mortality and to uncover the lived experiences of Black women so we can gain a better understanding of what's going on and what needs to change. Here are 6 steps. They can be found on our website. I won't go through them for time. And these are, we also have the health professional steps as well. You can find the full steps on our website as well. So that's, when we partnered up with the Royal College of Obs and Gynae. Chloe's going to read some positive quotes from some Black mothers as well.
Okay, so the first quote says, "This page has made me feel more comfortable having another child in this day and age. The information is fantastic. Cannot thank you enough. These stories give me hope. Black women need to hear positive birth stories and be empowered to speak up for themselves." And the last quote that I will read says, "Your campaign has empowered me, honestly, and for that I will be forever grateful." We have other stories on our website as well that you can read, positive stories.
So if you have written to your MP, this slide will be very familiar to you. If you haven't written to your MP, why not? You definitely should. There is a template on our website that you can use. Well, it's not really a template, it's a guide. We don't believe in template letters, as MPs will tend to get the same letters over and over again. They probably won't look at them, but we have got a list of things that you should probably mention in there. So I won't go through all of this for time, but this is a list of exactly what we want, and you can find that on our website again as well. So, Chloe, what can people do to support us?
So the first thing they can do is sign up to our newsletter to be updated. They can write to their local MP, which you just mentioned. Watch the debate live on the 19th of April at 6:30. Take your 5 times more selfie, donate to our fundraising campaign, and continue the discussion and help us spread awareness. And here's our details, which is www.5xmore.com, and our email as well, which you can get in touch with us.
Thank you.
Thank you very much, Tinuke and Chloe. As you can see, the 5 Times More team have been doing such fantastic work, but they are doing it against a situation in which, firstly, people acknowledge the statistics and are happy to just continue on with no real strategy for change, and in a situation where actually there's no specific funding for research into Black maternal health, or no specific funds put into combating the issues that Black women face with maternal health, which is an absolute disgrace. Today, well, this week rather, also happens to be Black Maternal Health Week in the US. But in the US, they have a situation where I think it's $200 million has been put into raising, into actually training clinicians about their own bias to help improve Black maternal health outcomes. The White House has put out a statement this week on Black maternal health, and the Vice President led a roundtable with Black mothers across the country. That is such a massive difference to what we're seeing here in the UK. And just going through some of the things that I've seen in the chat, it is very difficult, because you're seeing so many people having exactly the same experiences again and again, misdiagnosed, nobody listening to Black women when it comes to pain, that racist idea that we don't experience pain in the same way as other people. We are super strong, and things don't hurt us in the same way, and just continuing again in the poor outcomes that doesn't just have for the mother of a black baby, but also the baby themselves. Now, another statistic that I hadn't mentioned at the beginning is that Black babies are 121% more times likely to be stillborn and have a 50% increased chance of neonatal death. So 121% increased chance of stillbirth, and a 50% chance, increased chance of neonatal death. That is equally shocking. And again, no targets and no direct work to address that. Please do keep feeding your questions and comments into the chat. We're going to come back to them right after our panelists. I'm going to go to our next speaker now. Really, really pleased to have Dr. Shola with us.
Hi, everybody. Can you hear me?
We can. Thank you very much, Dr. Shola.
Yeah, I apologize. I'm going to have to drop off in like
Yeah.
I'm sorry. I was trying to get your attention to say that the time was running out for me. First of all, to Tinuke and Chloe, I have to say I'm so proud of both of you. Thank you for your incredible work. And I know that you are going to change the way things are done. Let me start by saying that I'm a mommy of 3 girls. Thank God. I mean, they drive me nuts, but let's not go there right now. And my first birth, I got scarred. I had a really bad tearing. So that tearing was from my vaginal opening to my anal sphincter. And that meant that I had to have 3rd-degree stitching. It was my first labor. Okay, so I remember saying very clearly to them, to the nurses and the doctor, that I could feel the needle going through my skin as they were giving me this 3rd-degree stitching. But nobody was listening. Let's just say that I did not know then what I know now. And it feels everything, let's just say that everything explains, what I know now explains what my experience was. Because we've all, even if it was meant to be a compliment, it's a backhanded compliment. You know, the kind you get from some aunties and uncles, but let's not go there. The point is, it does much damage to the identity of Black women, and it's very draining and exhausting. It wasn't created by Black women. This stereotype of the strong Black woman wasn't created by Black women. It was created by white people, okay? And let's just understand where it came from. And it victimizes Black women as a superwoman. You know we are not superwomen, right? But it victimizes us not as a superwoman you would think, but as a woman of hardship. That is what it does, a strong Black woman. And the perception of this strength is not admired as you would expect, because clearly if we were such super women, white women will want to be strong Black women, right? But they're not claiming that. They're not claiming that title, not very fast either. So the point is, as a woman of hardship, it is the legacy of female slaves who endured hardship, who were pitied, not empathized with, and that strength is not attractive. It is important to understand why it contributes to the higher Black maternal and pregnancy-related deaths we see today. I mean, Chloe and Tinuke touched on the point that it's 5 times more likely for Black women, right? That's in the UK. In the United States, though, pregnancy-related deaths among Black women are 3 or 4 times higher than among white women. But this racial bias about the pain threshold of Black women, it has a historical basis in the work of America's most famous gynecologist, James Marion Sims, okay? He decided to test all kinds of things on slaves, particularly Miss Westcott, as I call her, without any form of anesthesia. So you can only imagine what they went through. But once he got the solution to the problem he tried to fix, when it went to white women, they got anesthesia. But all of this feeds into the way Black women are treated today in the 21st century. Even as far back, not forget far back, even as far as 2017, recently as 2017, there was a nursing book that had all these pain thresholds for people from different ethnicities, giving excuses as to why our pain thresholds should not be taken seriously. So this is what I'm going to say to quickly round up. It is important for us to speak about our pain. It is important for us to speak, to change this narrative about who the strong Black woman is. And I particularly write about this in my book because I wanted it to be clear that when Black women say, I am a strong Black woman, it's not just words of empowerment, but words of powering up. Our words, when we say, I am a strong Black woman, it's a manifestation of the truth of our lived experiences, good and bad, without any baggage of the trope, the racist trope. It is an affirmation and a proclamation of enduring strength that is human, humane, and humbling. That is who a strong Black woman is, not what they try to impose on us. So I think the more we understand why this problem exists and that it is based on racism, the more we should go prepared when either us or people we know are walking into that hospital door or when they're getting home treatment to give birth to their children. Arm yourself with the knowledge. And I'm going to finish off with this because I'm fond of telling this to pregnant friends, that when you go to have your baby, when they ask you your name, epidural. Where do you live? Epidural. The only thing you need to be saying is epidural throughout. That's if you're into getting pain relief, because that was it for me. But thank you so much for having me on, and I'm going to have to leave now. But thank you very much for this incredible work being done.
Thank you so much, Dr. Scholl. It's fantastic to have you come and speak to us today and just so articulately go into the strong Black woman trope, as you do it in your fantastic book, which is right behind you. This is Why We Resist. Thank you so much for your support for this campaign. Thank you. Our next speaker, I'm very pleased to introduce, is Diane Abbott MP, the Member of Parliament for Hackney North and Stoke Newington, the former Shadow Home Secretary and a living legend. Diane?
Thank you very much, Belle. First of all, I'd like to thank the organisers for inviting me to speak at this very important meeting. I think most women never feel more vulnerable than when they are pregnant. It's partly the changes happening to your body. It's partly the sense that you are responsible for another human being, not just yourself. And the statistics that we're hearing about how Black women are 4 times, 5 times more likely to die in pregnancy and childbirth are truly alarming. But what is even more alarming is how little the National Health Service has done about this. I mean, they've paid lip service, but you had better believe that if white women were dying in these numbers, in these relative numbers in pregnancy and childbirth, the NHS would have done more and focused on it more. So there's been a little bit of lip service paid, and NHS people talk about language difficulties, which of course is ridiculous because many of the women you're talking about are not first or even second generation, but third generation Black women having their babies in British hospitals. They're talking about, is it access to antenatal care? Is it bad social conditions and so on? Well, there is something in that, but what researchers tell us is that even when you allow for poverty and poor social conditions, Black women are still much more likely to die in pregnancy and childbirth, and still more likely to have a bad experience. I've really been impressed by the campaigning around this issue. I've read some of what's been written. I saw the documentary, the Dispatches documentary. And I think the thing that comes up over and over again from Black women themselves is they just don't feel listened to. They just don't feel that what they or their partners have to say about pain is taken seriously by the doctors and the midwives. And there is this sense that Black women in pregnancy and childbirth are sort of otherized. It's what Dr. Scholler talked about just now, that we are supposed to be more resistant to pain, we are supposed to be superwomen. But as Dr. Scholler said, there's no advantage to Black women in being superwomen. It just means people think they can treat us with less consideration than they would give to white women in the same situation. And I know of what I speak. So what I want to say is there needs to be a lot more focus on the reasons behind these frightening statistics for Black women dying in childbirth and pregnancy. There needs a lot more to be done to make sure that people are actually listening to Black women and their partners when they're trying to talk about their experience in childbirth. We want more diverse people in midwifery and in obs and gynae. We want more diversity, so women are engaging with professionals who look like them and are less likely to dismiss what they've got to say. And we need to set targets for bringing down these levels of deaths. It cannot be right, as Ribeiro-Addy said earlier, that your experience of childbirth and your likelihood of dying in childbirth has to do with the colour of your skin. So I want to congratulate the campaigners. Have done a great job so far bringing this issue up the public agenda. I want to commit myself to supporting their campaign. And I want to say that, you know, just recently, in the last few weeks, the government brought out a report which said, in effect, there was no such thing as institutional racism, and that if Black people did experience racism in an institution, it was somehow probably our fault. Well, I think this issue of Black maternal health care and these terrible levels of deaths in pregnancy and childbirth show, if nothing else, that there is such a thing as Black people suffering racism in institutions. The government does need to focus on it. The government does need to take it seriously. The government does need to listen to Black people and Black women. And I hope, after we've seen so many years of the figures for Black women dying in pregnancy and childbirth going up, shamefully continuing to rise, I hope we are beginning to see, with all of us getting behind this campaign, a situation where Black women in pregnancy and childbirth get the sort of care and treatment they deserve, and these frightening levels of death come down. thank you very much for inviting me to speak today. Thank you.
Thank you very much, Diane. And you absolutely raise such an important point when it comes to the report and when it comes to this idea of institutional racism not existing, and that whole view that when something goes wrong, it's our fault. We are to blame. We are always to blame. And it's only recently that I've spoken up about my experience, inspired by the work of 5 Times More. And, you know, in response to that, and in response to previous questions, all I've seen is people quite horribly do this. You think that when you talk about the very, very traumatic experience of losing a child and nearly dying yourself, that people would be sympathetic. But instead, you've got people saying underneath certain posts, you always want to make it about race. You just want to talk about racism all the time. Why is this white people's fault? What's the other thing I have? You could do with losing some weight. That's probably the issue. But I'm not surprised at this, because when these statistics first came out, one of the health ministers actually said, well, then the black women are not necessarily dying from pregnancy and childbirth. They're actually dying because they have diabetes and obesity and these other issues. Now, there are some issues, just as you know, throughout healthcare with comorbidities. But I tell you, we do not all have issues before we're pregnant. In fact, many black women don't develop health issues until after they're pregnant. Having to justify all of this information is really horrible, because I feel like I have to justify and say to people, I didn't have any health problems before I was pregnant. I was a size 8 to 10. I was so healthy that I'd never even had chickenpox. But yeah, I still had an awful experience. And I think it's time that the government stopped blaming black women, institutions stopped blaming black women, and actually looked into targets to resolve this. We are going to carry on now with our next speaker. And we do have such a fantastic panel today, and I'm so grateful for everybody that's come to speak to us. We have Sarah along, who is a diversity and inclusion advisor, and she has a presentation for us. Sarah?
Hi everyone, can everyone see my screen? Everyone should be able to see it now. Can everyone see my presentation? Give me a thumbs up. Yeah. Cool. Good evening, everyone. First of all, my name is Sarah Alonge, and I am a diversity and inclusion professional in the legal sector. I'm extremely honoured to be invited to speak about this topic, specifically the experiences of Black women in the United Kingdom. Looking at the experiences of Black people and Black women face, and the experiences that they face on a day-to-day basis, you'll see that there's a thread that highlights inequality at different stages of a Black woman's life. So if we're looking at the scope of racial inequality, so like I said, we are going to be looking at some statistics which will link to maternal health. Cool. So Black people are 3 times more likely to experience discrimination in the workplace than their white counterparts. Black employees hold just 1.5% of top management roles in the UK private sector. These numbers worsen when we look specifically at the experiences of Black women. A recent report written by Erica Brodnock, Exploring Diversity Beyond Gender in Access to Venture Capital, found that Black female-led companies receive just 0.2% of the total amount invested, in comparison to 81.4% of white men and 9.2% of white women. Black women experience significantly poorer labour market outcomes and have worse outcomes compared to any other group. And UK Black-born women are the most underrepresented in the top percentile of incomes as compared to all other women and men. So some of you may know these stats, some of you may not be shocked by these stats. I just realized it's not on full screen. Let me just put the presentation on full screen.
Thank you.
Sorry. Gonna see. Some of you may have heard these stats before, some of you may not be shocked by these statistics, but I grew up believing that, you know, we lived in a meritocracy. And like I said, I work in the legal profession, so day in and day out, I'm faced with the reality that, if anything, we don't have a meritocracy. And if we did, then why would over 40% of all Black African employees with A-level or graduate level education be working in jobs that are less qualified for the qualifications that they hold? So now let's look at Black women and health. Okay, before I go into that, actually, so I'm going to tell you a bit of a story about someone that I know. So like I said at the beginning, there's a thread when we look at the different experiences that Black women face. So in 2019, after being misdiagnosed on 3 occasions, Kanayo, a friend of mine who I'm so happy that I can speak about in present tense, was misdiagnosed. She eventually was diagnosed with Stevens-Johnson's syndrome, which is a rare but serious disorder that affects the skin, mucous membrane, genitals, and eyes. SJS is a disease that's also most commonly found in women. Men can also get it, but there are more cases of women who have SJS. So Kanayo was misdiagnosed, like I said, 3 times before she was eventually rushed to the hospital, where she collapsed and had to be resuscitated back to life. That year, there was another woman who had the disorder, and I should say that it's extremely, extremely rare, this particular disease. And on the first day that symptoms started, she went to her GP, as you would do. And when she got there, she was quickly diagnosed, rushed to hospital, and treatment for her started. Now, these are 2 women who had the same issue, but there was a massive difference. And what was that difference? One patient was white, and the second patient, Kanayo, was Black. So why is this relevant to what we're saying today? So on doing her own research, if any of you know Kanayo, who I'm speaking about, she's a bit of a nerd, like what Tinika said at the beginning. So she went to go and look at all these various journals that looks that, you know, our doctors would use to identify skin diseases, skin disorders, and so on and so forth. And she found that there wasn't a single image that represented skin disease or skin disorder on darker skin. So I thought, you know, let me go and check on the NHS website. You know, what does a skin disease look like? How does it present itself on the body? And when I went to the NHS website, I scrolled down, and the only image that I saw was this image. Now, why is this in particular an issue? Yeah, because we aren't represented even in the journals that our doctors use, our clinicians use. So for the person who may, you know, have a symptom and want to go and check up, you know, what it looks like, they aren't able to see themselves, so they won't know what, you know, a skin disorder presents itself as. And to the doctor who's looking after you, they also have been taught in a way that doesn't present what this particular disease looks like, you know, on darker skin tones, on black skin tones. Carrying on the conversation of health, Black women are more likely to receive late diagnosis and are nearly twice as likely than white women to be diagnosed with late-stage breast cancer. I'm bringing in this stat because what we're seeing is that when there are issues that affect women more than they do men as well, Black women are the most disadvantaged in these groups. And as you all know, Black women are 4 times more likely to die during childbirth. So what are the challenges that we have here? Our medical profession is not equipped with the resources to understand how Black people present illnesses. But I think if we're being really honest, the bigger issue that we have isn't just about how, you know, under-resourced or ill-equipped the profession is, but it's about the conscious bias and the racism in the medical profession, which, as Belle spoke about and as Dr. Shola spoke about, dehumanizes Black people. Racism in the form of microaggressions, as well as false beliefs in the biological differences between Black people and white people, all cause the dangerous reality that we are facing and that we are currently living. And is why we see the figures that we see now. So what needs to be done? Work with Black mothers to find out how to improve their experience. Some of you may have heard a saying, nothing about us without us. And it comes from a book written by a man called James Charlton. And the book expresses the conviction of people with disabilities and, you know, them knowing what's best for them. As a Black woman who may have experienced, you know, ill treatment, a Black woman knows what is best for her, right? She knows what she needs. And then we have to have training and updated resources for clinicians. It's not enough to have, you know, the tick box, unconscious bias training, and you go behind the screen and the biases all remain. If we're really truly looking for a profession or a healthcare system that is not racist, we need to have the adequate training to even dispel some of the myths that, as Dr. Chola said earlier, about these nurses' books that had the false information that, you know, Black women and brown women have different pain thresholds. If people still have those mentalities, then change just isn't going to happen. We need clear reporting systems and disciplinary action. And why this is really important is, like I said, I work in the legal profession. And what we have found is that if people can get away with the same things over and over again, they're going to carry on doing the same things over and over again. And those who are coming behind them will think, oh, it's okay to do this. So how if I have an issue, for example, how am I reporting it? You know, what then happens to the person that I'm reporting? And in order for this to happen, there needs to be a safe space. And this is a safe space for mothers who are having children, or you know, mothers who may feel like they are not being treated correctly, to speak up. If they speak up, then it's less likely. If they speak up and then the right action is taken, then it's less likely that another mother will have to go through the exact same thing that that mother went through. And set targets, right? You know, it's all well and good to say we acknowledge an issue happening, but you can't acknowledge it without, you know, a solution, finding a solution to this problem that is there. So set targets. Let us know that, yes, you know, it is safe to have you know, children in the UK, but let us know that not only is it safe, but my experience will be good, that I don't have to think about the fact that there is I'm 4 times more likely to die, or that, you know, the midwife may think that I'm exaggerating my pain. And I'm going to end with a point that I thought about yesterday, and it's a quote. I thought, let me end with my own quote that I just made up. And it's: the system being flawed tells us why entrance to a profession or access to adequate care is not the same for all people. But once you're through those doors, the experience of unequal treatment, being ignored and overlooked, tells us that a system is racist. Now, the truth of the matter is, we can say whatever we want to say, but it goes down to the fact that the health system that we do have is systematically racist. And if we're saying that, you know, we live in a meritocracy, or we're staying in a place where everything that we have is based on merit, then really and honestly, a Black person or Black woman would not have to work twice as hard. And a Black woman surely does not need to scream twice as hard before she's heard or listened to, or even her experiences are appreciated. And that is it from me.
Thank you so much, Sarah. You highlight some really crucial points, overall looking at what our experiences are within the healthcare system and how biased they are. No matter how much people tell us that institutional racism doesn't exist, it's clear that it is alive and well. And until we address it in all its forms, we're going to continue to see terrible statistics like this. And you know, like you, I'm so concerned that even though they know all of this and it's laid out, there are currently no targets and no attempts to bring it to an end and to close the gap. And that is why we're all here today. Now, towards the end of the meeting, you are going to be able to have an opportunity to find out what you can do to be more involved in the campaign, and what you can do to push the buttons of the right people to have effect. We're going to continue with our speakers and until we get to the questions and then the final ask at the end. And I can see across the chat that a lot of women are sharing their personal experiences, and I think that's very powerful. And we're going to hear from Sylvia Parks, who is the mother of Delissa Parks and the founder of the Dcp Foundation. When a mother dies, or when a child dies, there are so many other people that are affected by this loss, and we're really privileged to hear from Sylvia today about why she has been leading the charge in seeking better Black maternal health outcomes. Sylvia.
Hi, good evening, everyone. Good evening. My name is Sylvia Parks. I'm mum to 7 children. I had 7 children. So I know very well how childbirth goes. My daughter, 26 years old, was having her first baby. She presented at the hospital on the 7th of October, 2015. She had issues with constipation all her life, well, since she was young. And when she got to her teenage years, we just assumed that she was managing it. She didn't want to talk about it. And so pregnancy highlighted that issue. We didn't know about that. She presented to hospital. Baby's head was high and free. And for all of us mums that know you're going to early labor, at the onset of labor, your baby goes down into the birth canal. Backtrack a bit, a week or so before that, she had the baby had not turned. So the baby was breech. She wanted a pool birth, and I advised her against it, but she still was hoping to have a pool birth. She went to the hospital and they attempted to manually turn the baby. They did succeed, but when we saw her that evening, she was ill. She was vomiting. The baby was kind of like a funny angle in her tummy. So the baby had not gone down into the birth canal. She was really sick over that weekend. She went back to the hospital, and this doctor said that, you know, she was fine, checked her over, sent her home. The baby was still high. Her tummy was still misshapen. She was still feeling ill. She went into labor on the 7th of October, and I advised her, on my way to work, I advised her, go to the hospital. Got one of her sisters to go with her. They examined her. She was 1 centimeter dilated. Baby's head was still high and free, and they sent her home. Her sister begged for her. She was told that if every mother presented, every woman presented in the hospital at 1 centimeter, their wards would be full. The very next day, early hours of that morning. So I got home from work and I looked at Delissa, and she just looked terrible. And you know, as a mother, you're kind of highlighted to these things. But my husband came in and he saw the same thing. Her skin looked clammy. She looked swollen. She couldn't go to the toilet because she was badly constipated. Midwife had given her suppositories. She was really in a lot of pain. She couldn't eat. Wanted to eat. She couldn't eat. She did eat something, and we kind of watched her. She had a show that evening, and we were all excited. Yes, baby's coming. Early hours of the morning, Delissa started to bleed. Light bleeding. I checked her. I thought she was fine. We called the ambulance. I did plan to drive her, but I wouldn't drive her like that. She was kind of screaming in pain. We got to the hospital. A little while later, she was 9 centimeters dilated. So almost ready to push. They examined her. They put her into a pool, the birthing pool. She was pushing stools. They took her out, cleaned the pool, put her back in again. And all this time, this midwife at the hospital didn't really engage in a conversation with me. But at the time, I'm not thinking, my mind's focused on Delissa. I endeavored to do a video camera of Delissa, and the midwife told me to turn it off because she couldn't see. But I'm so glad. They said that the light couldn't let her see. But I'm so glad that I had that. I had that video, because in having that video, I was able to show afterwards that she couldn't find a pulse on the baby. She was struggling to find a pulse. In pushing, Delissa's membranes, the midwife told us to sit on the toilet, and that the stools, the baby's head is behind the stools. Once she went, the baby would be born. Delissa's membranes come down while she was on the toilet. Midwife then said she was going to sever the membranes, and she did that, and Delissa started bleeding. Nobody called, pressed a button. She was put in a chair. She was brought up to the labour ward, a floor away, and they couldn't find a pulse on her. They finally on the baby. They finally found a pulse on the baby and rushed her for emergency cesarean. The baby's pulse and her pulse were the same, and you know, baby's pulse supposed to be faster than mum's pulse. Delissa looked up and said to me, am I going for a cesarean? I said yes. I got up to go. They told me no. That's the last time I heard Delissa's voice. Delissa died soon after they had removed Soraya, a baby, by emergency cesarean section. There was a blood clot behind Soraya, and as soon as they moved her, it went straight to her lungs. She had heart attack after heart attack. And my daughter, they came and told us pupils are fixed and dilated in the evening. I can't even tell you what time, because right now I can't even see that. Delissa died and her baby survived with severe, profound brain injury. So we went to inquest. A doctor came, and the doctor came to give his evidence, the one that turned the baby. And the reason for him doing that was because Black women's pelvises are different than white women's. And that's why he did not see a problem with the baby's head being high and free. The coroner questioned it. The hospital trust was fighting against their name being on the death certificate. But he assured us that because of what happened at Hillsborough, he had to put a narrative on the death certificate. And he did. And it's questionable, it's shocking. I know whatever color you are, your pelvis is no different to give birth to a baby. On the first anniversary of her baby is now 5, she'll be 6 years this year. She's doing so much, but she is profoundly brain damaged. On the first anniversary of Delissa's death, I had to do something. I just felt like I had to do something. You know, we just can't, you know, our life has just changed. We're taking care of our granddaughter. We're grandparents. You know, we kind of just started to enjoy our lives, and life just turned on its head for us. We are fighting for every aspect of her care. We're fighting the trust. We are, it's been life-changing. I launched the DCP Foundation, the Delissa Christina Princess Foundation. Princess because that's what she referred to her daughter, you know, of when she was pregnant. Hoping, and my hope is to raise awareness to what is happening around maternal births, around maternal births, and just to make, you know, to help and support, you know, young women, Black women. I mean, it's mind-blowing. 5 times more contacted me. I just want to say thank you guys. Thank you guys for all that you're doing. I have not been able to think or to, you know, since this happened to us. We haven't had a night's sleep. We you know, it's stressful. So I've launched this this foundation. I haven't really got it off the ground, but God has been good, so good. He's directed me and the foundation down so many different avenues, and it's really and truly working out for us. And I feel a whole lot better if I can do something to help this cause. So yes, we've got a website now, www.dcpfoundation.co.uk. If anybody can help me, you know, I would much appreciate it. And thank you guys again. Thank you 5 times more. Thank you for this forum to be able to tell her story. I'm not a talker, I'm not a speaker. You can see I am, totally distressed. We've got other issues that we're dealing with, my mum in palliative care. But God has been good. So I just want to say thank you, everybody. Thank you. Please support the cause. Please let us, please see if we can stop this from happening. If we could help one person, then Delissa's death would not be in vain. So thank you so much. Thank you.
Thank you so much, Sylvia, for sharing that really. I'm sorry, you've still got me. It's such a heartbreaking thing to hear. And as you can hopefully see from all of the messages in the chat, condolences coming to you from everywhere, no matter how long it's been. We know that the pain goes on. So, you have our condolences, and thank you so much for taking the time to come in and share your story with us, but also for doing all you can to raise awareness. I think that's really important. It's so key. But and just to say again, just as Sylvia has pointed out, all of the Black women, 5 times more, Sylvia, parts of the Dcp Foundation, so many other groups that have come together that are talking about this and are doing things about this, are not the type of organisations that you see that get the support to raise awareness. And it's really important that as many of us as possible continue to support them. I cannot stress that enough. They're doing it by themselves with literally nothing. Thank you so much, Sylvia. Our final speaker before we go into the conversation, I can see some of you are still posting questions. Please continue to do so. Is Dr. Jenny Douglas. She's a senior lecturer in health promotion and the chair of the Black Women's Health and Wellbeing Research Network. Dr. Jenny.
Thank you. Thank you very much for inviting me to be part of this, and thank you all for actually organising around this really appalling statistic. And can I just say thank you to Sylvia, for sharing her heartbreaking story, because that is a situation that should never be allowed to continue to happen. I come from the Black Women's Health and Wellbeing Research Network at the Open University, and we have been in existence for the last 10 years, it's going to be. And the reason, I'm just putting in the chat if I can, that's the link to our website. And the reason for us coming together, it was Black women researchers from across the UK who came together because we were appalled at the lack of research on Black women, that even in relation to minority ethnic communities, there seemed to be more research on other minority ethnic communities and a real lack of research on Black women and Black women's health. And we felt it was really important that we started to at least raise awareness of some of the issues that that Black women experience. So we had a major conference, as I say, 2011, and we've had many seminars since then. And most recently, in March, we had an international webinar with Black women in the States, Black women at the Black Women's Health Imperative, Black Women's Health Study. Now, the Black Women's Health Imperative in the US has existed for 40 years. So they are an organisation that have been working to improve the health of Black women for 40 years. Black Women's Health Study has been running for 25 years in the States. And also there's another recent project, Mother Lab at Tufts University. Now, we do not have anything like that here in the UK, even though we know that there are inequities in relation to Black women's health. We're very sharply focused, and rightly so, on Black women and maternal mortality. But even before we had the kind of more formal statistics that we've had for the last 5 to 10 years, in the 1980s, there's research by Joe Larby and also by Anne Phoenix about the poor experiences that Black women had of maternity services. So this is not new. This has now been happening for decades. And I mean, it's really heartening to see that, you know, many people are coming together around this issue. As Chloe and Tinoke said, the statistics were 5 times more, and they have dropped very slightly to being Black women are 4.3 times more likely to die in pregnancy and childbirth. And I would argue that that is due to the activism of 5 times more, and other Black women who maybe Black women journalists, Black women MPs, who have actually come together to raise the issue. So it's Black women who've had to put this on the agenda for health professionals and health authorities. So as I said, it's been an issue, you know, since the 1980s. Now, similar rates are found in the USA, you know, where Black women may be 5 times more likely. It may be higher in some places in the USA. But in the USA, there is not a National Health Service. Here, we have a National Health Service. Here, we should be able to put targets. We should be, each provider, healthcare provider, should have targets set in relation to maternal mortality. That is what we need to do in order to bring the rates down. We're talking about maternal mortality, and although it is horrifying, it really is the tip of the iceberg. Underneath that maternal mortality, there is a huge amount of maternal morbidity, the near misses, the women we don't hear about, who actually suffer traumatic childbirth and have long-standing disability and poor health following childbirth. And, you know, so, you know, we need to do more about this. We've already heard about the higher rates of stillbirths and neonatal deaths. So this is something that runs right through the experience of Black women in reproductive and maternal health. A woman who's been doing research in the States for a long time, Arlene Geronimus, she talks about weathering, and her research points to the fact that Black women are physiologically 7 years older than their actual chronological age. And this is due to the day-to-day experiences of racism at work, racism, you know, personal racism, but also institutional racism. It could be within education, could be in healthcare, and that this drip effect of racism has a biological effect on us as Black women. And we don't have this research here in the UK. Now, I think that we should be acting on the research that we currently have. But in addition to that, we should be developing appropriate research that is led by Black women, that involves Black women, that is able to demonstrate how institutional racism actually occurs within the NHS and looks at the experiences that Black women are having across the life course. It's happening to young Black women, it's happening to childbearing Black women, we know it's happening to older Black women. And we all know that COVID has shone a light on the inequities that actually exist. So, you know, we have a lot to do. But I think that together, we can actually work together, both to raise awareness and to put pressure on organisations to effect change. And so I will just end with the kind of words of Alice Walker and June Jordan. We are the ones that we've been waiting for. We together are the ones that actually can change.
Thank you. Thank you very much, Dr. Jenny. Absolutely, we are the ones that can create that change. And that's why it's so amazing to see how so many women in particular have come together this evening. I have, in the past year, been on a lot of different Zooms, as I'm sure most of you have, but this is perhaps some of the most engagement I've seen in the chat in terms of people putting forward lots of different questions and you know, all of the different comments. And I know that people are dedicated I believe, to making change. So we're going to answer some of your questions now. I'm going to put them to some of the panelists. So if we can remove the spotlight so we can see everybody. And then thank you to those of you who actually put in questions before the meeting, even without being asked, which is fantastic. So our first question is from Zia, and Zia asks, has the classification of ethnic minorities as one homogenous group, BAME, caused higher maternal mortality in Black women? Views. I'll ask Tanuke and Sarah. I'll try and take a couple of you for each question, so that we're not going around, because there are many questions.
Sorry, Belle, I just want to make sure I understood the question correctly. Would you mind repeating it, please?
Yeah, I think Zia's asking, has the classification of ethnic minorities as one homogenous group, BAME, caused higher maternal mortality for Black women? I think she's trying to get at the point that putting us all together in one group, has that caused an issue in terms of care and how we're seen?
Well, I think you have to look at, what we said in our awareness week, that you do have to stop lumping anyone who is not white as BAME. There are differences clearly, even within Black. You've got Black African, you've got Black Caribbean, and even within that, you've got Ghanaian, you've got Nigerian, you've got Caribbean, you've got Jamaican. There's so many different types of Black, and I don't speak for all Black women. We are not one homogenous group, but I think it is quite dangerous when you lump. Because you miss those cultural nuances, you miss the fact that somebody might be newly arrived to the UK in comparison to someone who is second or even third generation, and what their experiences are like within the NHS and within maternity services. So to answer your question, I definitely do think that will play a big part in what we're seeing here.
Thank you very much, Tanuke. Sarah?
Yeah, just to add to that, I think it's really important that if we don't stop, using that acronym BAME, BAME. And one of the issues is, even if you're looking at the data from individual hospitals, it can tell a story that is untrue. So if a hospital, for example, looks at it just as one homogenous group, and their numbers aren't that bad because there hasn't been, that many numbers just looking at a particular ethnicity within that group, then they will think they don't have a problem. But then when you strip that all back and then you look at the individual groups, then you're able to tell what issue you have. So absolutely, if we just look at it as one group, then we aren't really seeing the true impact and what what the data is telling us.
Thank you very much. I'm going to ask, actually, this is a very interesting question. What can I do as a white first-year student midwife? And I think that's really important. Midwives talking about what they can do, and actually just the idea of being an ally. Obviously, this is an issue that is affecting Black women, but it's important that everybody in society takes the issue on board and does what they can to be part of change. So what can I do as a first-year white student midwife? I will ask Diane and Chloe.
Yes, so what she can do as a first-year midwife, first thing she can do is, if she sees something not going right, or if her midwife mentor is not doing the right thing, to actually speak up about it as well. Don't let these sort of behaviour carry on going on. As a student midwife, she should be able to talk to someone about, treatment that's happening that she feels is not correct. Also, like you said, she can be one of our allies. She can also speak up, like I said before, speak up on the treatment that she's seeing that she feels is not correct. Go the extra mile and treat the woman as an individual. I always say this, but I feel like midwives and student midwives, we need to treat women as an individual, see that woman as who she is and not like a group. I think that's the best way of explaining it.
Thank you, Chloe. Diane?
I think the question of how to be a good ally is really important. One of the things that comes across in this debate about Black maternal health is that Black women just don't feel listened to. And one of the things you can do and continue to do as you move through your career is listen to the Black women you're caring for and listen to your Black colleagues for that matter. But I think that Black women often feel a little dehumanized by their experiences of pregnancy and childbirth, and you can be different. You can listen, you can relate to these women as human beings and take seriously when they talk about pain or their partners talk about pain.
Thank you very much, Diane. And I'd also add to that, not to make assumptions. I think sometimes the assumptions that midwives and doctors and clinicians overall make about Black women when they are having these, when they're going through pregnancy, when they're going through childbirth, often cause a lot of issues. Now, in an MP's briefing, we talked about how people label us in terms of our ethnicities when they're collecting this data, because one of the major issues is we've not had a lot of data. And I remember my own personal experience going to visit the midwife, and obviously they're taking my information, taking my partner's information, and they asked me, where I was born in the UK. They asked what my what I would describe myself as. So, are you born in the UK, of African origin? I could see her marking down, and she asked where my partner was from, and I quite innocent. If you ask me where I'm from, I'll tell you I'm from Brixton. I'll tell you I'm from London. And she asked where my partner was from, and I said Portugal, and she said, "Oh gosh, that's going to be a beautiful baby." And I said, and I saw her marking a different part of the form, and I realized what she had done. She thought that he was white. And I had to explain to her that, like me, he was of African origin, but born in another country, in a European country, and so he had that nationality. And that was the question that I believed she was asking me. And I patiently waited after explaining that he was Black for her to still tell me that my child was going to be beautiful, even though my child was going to have darker skin than she thought. And it's these types of assumptions that can cause problems when they're attempting to do certain tests, as well as the fact that at some point I had to, I used to relax my hair at the time. I was wearing a black headscarf over my head, couldn't relax my hair anymore, in between braids, as you do. And I think there was an assumption at the time that I may have been Muslim because I was asking questions about the gender of my baby. And that's because I don't like surprises. I'm not one of those, I'm going to wait and see. I was excited. I wanted to know what I was going to have. And in one of those questions about the gender of my baby, when I was meant to be being checked for something, I was eventually denied a scan, and that led to further complications. So it's about challenging those assumptions, those sometimes racist assumptions. People call it unconscious bias. I don't think it's unconscious, but challenging those assumptions that sometimes can have massive impacts on the care that healthcare professionals, midwives, doctors, nurses end up giving to Black women.
Oh, can I just add something?
So go ahead, Sarah.
Yeah, so one thing about being an ally is that whether we like to accept it or not, but if you are an ally and you are white, you are actually speaking from a place of privilege. And the reason why I say that is because white privilege does exist. So we need as many people to amplify the voices of the unheard until they are heard. So if you are a student midwife and you see something that is wrong, like Chloe said, remember that you also have a responsibility, because your voice may actually be heard over a Black person who's speaking about the very same thing. So remember the privilege that you have and use it to amplify the voices of the unheard.
Thank you. Absolutely, Sarah.
Sorry, Belle, can I add as well? Just to
yeah, of course.
Close point on individualized care. So I have 2 children, like I mentioned in the beginning, and one not so great experience. And my daughter, who I gave birth to about a year ago, she's 1 on Monday, the day of the debate. Don't know how that happened, but so if you cast your mind back to a year ago, we were mid-pandemic, mid-lockdown. Everything was really scary in terms of hospitals, going into hospital. People were really scared of COVID. It was very serious back then. And I personally was somebody who was like, I'm going to wait at home until I'm ready to push, because I just don't want to go into hospital and catch COVID. It was that time, right? You know, you touch a doorknob and you thought you would catch COVID. It was just a crazy time right there. Despite all of that, I actually ended up having a fantastic experience giving birth to my daughter. Especially in comparison to my son. And I would definitely say it was the midwife. It was the midwife who took the time to understand me, to listen to what I wanted to. She was very calm, you know, when I said, I think I'm going to push, you know, she just very calmly, you know, said, that's fine, you listen to your body, you know your body best, so you push when you're ready. In comparison to the first time when I was told, you know, I was saying, I can feel the baby's head, I'm going to push. And I was told, no, don't push. I was literally being screamed at, shouted at by the midwives. And it was all very scary at the time. There was one point during my labor experience with my daughter that I had pushed, and they saw that there was indeed meconium. So she was distressed. And even though the midwife was, there was a slight panic, because she was like, look, if I don't see baby's head within the next push, we are going to have to come out of the birthing pool. Sorry, I didn't mention I was in a birthing pool. We're going to have to come out of the birthing pool. I'm going to have to take you straight to the delivery suite. But it wasn't oh my God, like, you know, like this is awful, this is terrible. She was very cool, calm, collected. You know, she really, she empowered me. She helped to empower me. And I, you know, with every bit of strength that I had within me, one push and she could see the baby's head and she was like, forget what I said, it's fine. This baby's coming out, nothing to worry about. And it was just very, she took the time to make me feel calm and to just listen to me. And I think that is very, very important, listening and being empathetic and trying to build that relationship with the patient. I know that like NHS, you know, things are very stretched. People don't have as much time. You know, it's a very high pressured environment, but within the same 5 minutes of time that you have with somebody, you can make a big difference in how you treat them and the relationship that you can build there. So just thinking about how you're treating your patients and how you really are giving them that individualized care makes a world of a difference. So yeah, thank you. Thank
you very much, Tineke. I have another question here. As a obs and gynae junior doctor, who's also a woman of colour, what can more healthcare professionals do to minimise this racism? Dr. Jenny, I'm going to come to you.
I think it's similar to what has been said before. The key thing is to listen to women, believe women, trust women. Because, you know, as Black women, we do know our bodies. I think that for health workers, also should try and educate themselves, you know, because I think there is a lot of literature now about, sadly, because of George Floyd, there's a lot of literature about Black experiences. So, you know, there's a way in which health professionals can educate themselves, and that, in fact, they can advocate for Black women. I think the other thing perhaps we need to raise is that, you know, for Black health professionals, they themselves are experiencing racism. And it is sometimes difficult for Black health professionals to do what's right, but, you know, if they feel that they are going to be criticised or challenged for decisions they make, they may not feel that they have the strength to do that. So I think at all sorts of levels, we need to strengthen and empower Black women health professionals, because you know, so that those Black women feel that they have got the power to make decisions in the best interest of other Black women.
Thank you very much, Dr. Jenny. I saw actually at some point during the chat, someone made a point about mental health support, and I'd be grateful if they could repost that, because the chat is going by so quickly, about specific mental health support for Black men and women. Now, the next question I have, which I'm going to ask Sylvia, if that's okay. Some women may also be under the care of partner agencies, for example, perinatal mental health services. What roles do you think services can play in kind of improving racial disparities during this time for mothers, babies, and the wider family? And I ask this question, Sylvia, because what you've been through, what your family has been through, is very tragic. But my personal experience was that mental health support wasn't really available. And I'd like to ask whether it was made available to yourself and your family, given what happened, and how much you think it would have made a difference.
So, no, well, yes, we had, because you can imagine, you know, we were in the midst of life, and this happened to us, going to work. The next day, I actually assumed that she was going to give birth, and I'm off to work, and that didn't happen. So it just can't. And you know, there's many of us, many children. We got one son, and it affected him so badly because him and his sister were so close. There was nothing, you know, at the time. The hospital trust, who we had to go through a legal claim. The actual hospital trust just said we had to wait for that time to come. So they did get us involved in a cruise, but that wasn't for us. It was as if one box fitted all. And you know what, they didn't want me and my husband to be counselled together. It was just really weird, because we all of this had to move into a different area, which was predominantly white. It was awful trying to access medical help, medical care. I think we were probably the only Black people in this area. And this woman what came into the house, you could see either she feared us or she wasn't ready for us. But I realized after a couple of meetings that this wasn't really for us. We've now gone down the private route of having to obtain counselling for the whole family, because you can imagine what's happened. We're a big family. We've, you know, we moved far away, so the support wasn't there for my other grandchildren. You know, Soraya's number 9. We have 12 grandchildren. We weren't able to support them from day one. I couldn't even think for myself, let alone support my children. And this has affected them badly. So no, I don't think the support is out there. Unless you've got money, there's no support out there. And I think this is something which I really and truly would like to highlight and find help for in the DCP Foundation. It has been absolutely awful, you know. We've just started getting this family counselling now. We have our last daughter that's in uni. She's a strong, tough little girl, because this happened to her when she was in year 9. And she came home from uni for Easter crying, said, "Mom, I just cry for no reason." And that got me, you know, to think that we have not been supported. I mean, now she's accessed the counsellor that the whole family's under. So I'm happy for that. But what effect has this all had on us for waiting for so long for this? It's been absolutely life-changing, awful.
Thank you very much, Sylvia. And you're absolutely right that there generally overall in the country massive cuts to mental health services, but I can see that it's been particularly difficult for Black people to access mental health services, but not just that, to find mental health services that are appropriate. And that's why I was so encouraged to see the post in the chat about specific services for Black men and women, which I think will go a long way. We do have so many questions. I'm going to try and find another one. This is a good one. As a future Black father, what can I do to help my partner? I'll ask Tinike and Chloe.
So we actually have recommended steps for partners on our website. So the steps go on and it talks about how you can advocate for your partner, how you can prepare for birth. So on our website we have it. I'll post it in the chat.
Thank you very much. Tinike?
I see Sarah smiling because Sarah's a good friend of mine. My husband, bless him. He was very at the time of, you know, especially the first birth. He wasn't the best advocate, I would say. And I think it was literally because he didn't do as much research as he could have in order to be able to advocate for me properly. And I think, you know, he was just under the assumption that, well, the medical professional knows best, so that's it, you know. And if you're screaming, you're in pain, or you know, that you need to be checked over or anything like that, if the midwife is saying no, you don't, you're fine, then you're fine, you know. Actually, without even realizing that I was progressing very, very quickly, and you know, there could have been earlier interventions. So I gave it to him. After that whole experience, I was like, look, next time this is definitely not going to happen. I need you to be able to speak for me if I can't speak. And I just made sure that he was as clued up as I was. And I think with everything, knowledge is power. And I think to be able to be an advocate, an adequate advocate for your partner who is pregnant, you have to do as much research and know as much as you can about pregnancy and childbirth, and also have the confidence to challenge, you know, if somebody says, well, I'm not sure, you know, it's, well, if you think that's true, can you write this down? Can you document this? Actually, can I record this? You know, there are other things. Okay, you're not taking my partner seriously. I want to speak to somebody else. I want a second opinion. Knowing your rights, right? Knowing what to expect and knowing your rights. I think those go hand in hand, and just having that confidence to really challenge if that situation does come across and you feel like, you know, your partner is not being listened to. Thank goodness I had a very positive experience in the second time round, and I had a really good midwife this time round, so he didn't have to do that much, but I think it would have made the world of a difference. Thank goodness for Sarah, who was there as well at the time for my first experience, so she was able to try and speak to the midwife to say, look, I know, my friend, something's clearly not right here. You need to check. But again, you know, knowledge is power. I'll leave that there.
Absolutely, knowledge is power. But I do remember, and I think this is from the documentary that the Dispatches documentary to Black Maternal Health, the Black Maternal Health Scandal. If you haven't watched it yet, please do. That Tinike and Chloe featured in, and there was one part where a Black woman was talking about how her partner was accused of being aggressive because he was asking questions, and I think the nurse was saying, if you continue to be aggressive, I'm going to ask you to leave. So I know that some of those experiences that people are having, that they're feeling quite challenged about when they are in hospital. So I've got one more question, but our time is far going, and I want to lead into the section where we talk about and 5 times more come back and tell us what it is that they want everybody to do. But this last one for everybody, it's about the Equality Act. It's about the law. It's about what really MPs should do, which is interesting because that's me and Diane. And it's asking how the Equality Act 2010 can become more effective in holding organisations to account and addressing this discrimination from an intersectional perspective of race, gender, pregnancy and maternity, especially when there are reports that deny and dismiss our lived experience. I'm sure you all know which report that we're talking about, but also linked to that question, another, what more can be done in Parliament, within the NHS to bring about these changes? So I'm going to go to Diane first.
Thank you. Thank you very much, Chair. Well, I think that all of us as MPs, and there's a number of MPs who are very concerned about this, not all of them can be here tonight. First of all, we need the data. There's never been enough data collected about this. And as somebody said earlier, it doesn't help just to refer to Black women. That can lead to oversimplification of what the issues might be. So we need to insist on keeping proper data. We need to continue to insist that we see more diversity in obstetrics, in gynecology and in midwifery. And we need to make this, I think, very clear demand for targets to bring down these levels of Black women dying in pregnancy and childbirth. Thank
No, I would agree with that we need to have some very clear targets. We do need to have some research that actually demonstrates the ways in which racisms actually occur within institutions, because it's been very difficult. We talk about, we give the voices of Black women, and unless we've got some hard data, organisations don't want to take it on board. Organisations don't want to change. So I think we need to have some more rich data that actually, drills down to what are the processes that actually cause this institutional racism, and that looks at the specific experiences of different groups of Black women. Because I think that, we experience racisms in different ways. And I think that until we have that data, it just, people can just say, oh, it doesn't really exist, or it's your fault, and blame us for things that are happening. But I also feel, and I said this before, that any research that is done has to be led by Black women, has to have Black women actually identifying the research questions and Black women setting the agenda. Because too often we have research that's done by white organisations, by white women who are very well-meaning, but they do not know the questions to ask to find out the specific experiences, the specific lived experiences of Black women. So, I would say that is something we need to do with urgency.
Thank you very much, Dr. Jenny. Our time is fast spent, so I'm going to hand back over to Tanika and Chloe, who are going to tell everybody what it is that you can all do to be involved. No movement is a couple of people, so we're going to need all of your support to make sure that this issue is raised at the level that it needs to, and we get the change that we deserve to improve outcomes for Black women when they're in pregnancy and childbirth. Tanika and Claire.
Thank you once again. So we briefly touched on this at the end of our presentation. So if you weren't here to see that, we'll just quickly go over it again. But it's a few things that we're asking of everybody, sign up to our newsletter for all the updates so that you don't miss anything. We're very active on social media, but sometimes certain things can be missed. So signing up to get the emails directly into your inbox is first and foremost. Please, 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 if you haven't already, write to your MP ahead of the debate, which is taking place on the 19th. We had a briefing yesterday with some MPs, which was fantastic. And we actually asked them to pledge to sign the 5 times more Black maternal health pledge. And I think it's important that you use the materials that are on our website to ask your MP to attend the debate and to sign this pledge to show that they are in support of what is going on and to have tangible actions that they can take as MPs. They have, some powers to ask their CCGs what is happening locally, and they can also call on the Department of Health to find out a little bit more about what's going on. This can be a bit over our remit as just normal people. So that's why we've got MPs, and it's important that we do make use of them. They are there for us. So please write to your MPs. Everything is on our website. Tweet your MP after you have done that using hashtag 5xmoreMP of Black Maternal Health so that we can find it and we can also repost and amplify that. I've just seen someone saying, where can we see the debate? If you go on the website under advocacy, the link to the YouTube is our parliamentary channel is already on there. So please go ahead and go in and save that. We will be obviously live tweeting and emailing on the day as well. Take your 5 times more selfie. Now, it doesn't sound like a lot, but actually it helps in pushing this discussion and moving it forward. That was one of the earlier things that we did within the campaign to get people talking. It's literally just a selfie. You post it like this. It represents that we are 4 to 5 times more likely, and also our recommendations as well. We now have 6, but in the beginning we had 5. So take your 5 times more selfie and have those discussions about your lived experience, about what you believe should be done. Raising awareness is just part of it, right? It's the first step. There are so many health professionals that we talk to that actually don't know that this is a thing. They think this is something that's happening in the US, something that's happening just not in the UK, but it's happening right now and it's happening here. So I think it's really important that we are having these discussions and we are raising awareness, because you can't change something that you do not know about. So those are the things. Again, if you go on our website, it's all there. Everything is there for you. And that's it. I don't want to talk your ear off. I know it's been a long day. A lot of you were probably really tired, and we will let you get on, and I'll let Belle finish up. But I just wanted to say thank you so much. Thank you to Belle, first and foremost, for taking this and running with it. Honestly, the support has been unreal. So I just want to say thank you. Thank you to Diane. Your speech was amazing. Your talk was amazing. Sylvia, you know how much love I have for you. We will do everything to amplify Delissa's story, Delissa's experience, and your organization and everything you stand for, because even within your pain, you are still helping others, and that is love. That is love. So I just want to say thank you for all you do. Sarah Olonge, thank you so much. Our D&I advisor, thank you for bringing the issues that we face as Black people, not just in healthcare, but in the wider society. Thank you for bringing that into the forefront. Thank you so much to Jenny, Dr. Jenny as well. You are instrumental in terms of research and what we need to see going forward. So I really do appreciate your help as well. And Dr. Shola, who is also not here as well, thank you. I appreciate the support. I could literally cry. Chloe knows I'm the one that cries in every single Zoom meeting. My daughter is sleeping right now, but I normally bring her up onto the screen around this point because I just want to make it clear to everybody that it's pretty disgusting that even with technology, even with the resource we have in this country, we see that these statistics are going up instead of going down. And I don't want my daughter, this should be her head, this should be her face. I don't want her to be campaigning about the same things in 30 years' time should she decide that she wants to give birth. So it's a collective effort, let's try and bring this down. At 5 Times More, we take a two-pronged approach. You know, we try to lobby, we try to get those in power to change, but we also try to help the women, you know, at the grassroots level. So if you have been affected by anything that we have spoken about today, please go on our website, please contact us, email us, and we can point you in the right direction. But thank you so much. And yeah, I'm going to stop now because I can talk forever.
Thank you so much, Tanuka. But Tanuka has quite fantastically thanked all of the speakers. So I'll just reiterate what Tanuka has said. And so I'm left to actually thank Tanuka and Chloe again for all of the fantastic work that they have done with 5 Times More, and how they've just brought this issue to the fore. And to the extent that we're having such an amazing conversation about it, I just want to let you all know that we're going to save the chat. Obviously, we'll anonymize it, but there's been so much great information in there. 5 Times More will be using it to make sure that we can bring out some of the issues that you've raised, but also send on some of those supportive messages you have to people that want to be more engaged. Now, so please do make sure that you're following 5 Times More on Twitter, because that's where you'll particularly find out all of the information about what's coming up on Monday, and where you can find the link to this meeting, actually, which was broadcast on my YouTube page on Facebook, so that you can watch back with others who may want to find out more. Thank you so much to everybody that has joined this call. And you know, just to end by saying this, so often Black women are seen as the problem. It's all our fault. We are the ones that cause this situation. Essentially we are the problem. That's the general idea that's put out in society. But you know, looking at this fantastic panel and all the people that have engaged in this, all I see is that Black women are going to be the solution, and that gives me hope. So thank you again so much, and please do enjoy the rest of your evening. Take care.